naturally, you should have pink on the lips, you should have pink on the gums. If you have a pet that has pigmentation, that black, purple, other places you can look. Flip the lids down, you can look at the pink in the eyes there. That's usually universal for just about everybody. Other than that, that's the real basics to say, are we turning blue or not? Now, obviously, if you look at your pet and you say, wow, they're on their side, eyes rolled back in their head, I don't see the chest moving. Pretty good possibility that they're not breathing at that point. You put Annie up on the table, she's a little big for that. But if you want to kneel down, squat down, just put your hands in here and get a feel for what that heart feels like. Bottom line is this, you're trying to pump blood to keep their heart alive, to keep their brain alive. Those are the only two organs when you're on the verge of dying that makes a difference. When you do CPR, it is a cardiovascular workout for the person pushing, okay? The times I have to do this in the hospital, I feel like I've run a marathon after I'm only done 5 or 10 minutes, okay? So get used to positioning yourself correctly so that you don't burn out. Doing it on a table like this is fine for me because I'm tall and because I have a small patient. If I put Annie up here, I wouldn't be tall enough to do this effectively because I'd be using all of my muscles instead of using gravity and using your bones. So in an ideal world, you want the pet facing legs away from you so that you tuck them in close to you. Different variations. Some people like to interlock their hands, some people like to do this. Doesn't really matter. Put your hands on the pet. Remember where we said the heart was. Pull the elbow back, it should be right about there. Right over the top of the chest there, lock your elbows. When you do this, you're using your muscles. And I tell you, do that for 2 minutes and you're gonna feel every single muscle up your body go. You wanna be locked in, you wanna rock, okay? Rock, and you gotta go hard. So you have to squeeze and collapse that. And I'm not going to do it just because I don't like our pets this much here. But you basically put your mouth over the opening there. Seal down. 1, 2. How hard to blow? Hard enough to make the chest rise. That's the goal. Let's first make sure he doesn't have a bone or anything down in his mouth.
Okay. So let's see over here.
Okay. What type of dog or cat do you have?
Yorkie.
Yorkie? You can probably go towards the lower half, right over there. So you're going to use the palm of your hand.
Yeah.
You're going to snug them up against you, real close. Yep. And you want to make sure that you're letting off enough pressure so that the chest comes up. You're closing the nostril there. You got to make sure that you get all. And when you do it, you want to make sure that you got to snug up against because they, especially Yorkies, you're going to be down here. You want to basically, they're going to push, but they're going to go into you. If they're out here, you're going to start doing that and going out the edge.
So just go this way. Like a V.
Yep.
And then
the pressure is okay this much?
You want to go, you want to compress like you were. So you want to go about halfway, and then you want to make sure that you pressure up.
Compress
Stay over top of them.
Compress and expand.
Yep. You want to try and keep your palm right over about where their hand is. Yep. All right. Good to go. String them up by their legs, shake them once or twice. If it doesn't come out, cup your hand. All right, so somebody's dangling. What did you hear? I can't get it out. Shake, shake, shake. Okay, cup your hands, feel the ribs. Now, if nothing's coming out after that,
He's not gonna like that.
it's probably not. If you squeeze your arms under like this and you lift up forcefully, you know, lift her butt off the ground, it pushes everything forward and tries to push the lungs out. So let's pressure bandage. You need something that is going to put pressure directly over the wound, and generally the thicker it is, so don't use just a single ply. Fold something up. All I did here was just tore up an old dress shirt that was kind of getting raggedy, so. Got a piece that I could put right there, so that's over top of my wound. And then long skinny pieces, and here's the key. You're just gonna tie your shoelaces, that's all. But when you tie the bow, you want it to be right over the center of the bleeding. How tight do you go? Tight enough to get the bleeding to stop. Don't do that.
Oh.
In both locations. I actually met her at Stow. She came in with the APL. She was in a barn fire. So the barn caught fire and most of the dogs perished in the fire, but they were able to get a few out. So Annie came in for basically triage and wound care and assessing how bad she was. One of the doctors decided to take her on and give her a chance. And as you can see, she got a little beat up. She has quite a few scars, but after a bout with separation anxiety and a little crate anxiety, she's all better now on the inside and the out, and I ended up adopting her. So lots of failure there. She is one of the best dogs I've ever met, and now she likes to do fun stuff like this.